31, 32, 33, 34, 35.
In 2000, Lydia Kwashie was a Ghanaian Nurse of the Year. Lydia, like many of her classmates in this graduation photograph, is typical of those skilled health workers who have left their country to work in the UK, Europe and the US.
41 out of 70. I think even there are more than that. About half of the class.
Life travels back home with Lydia to investigate what this brain drain means to a country like Ghana.
Midnight, March the 6th, 1957. Independence. Ghana belongs to herself. Schools, clinics,
That future wasn't always smooth. Since independence, Ghana's had a mixed history. 4 republics, 4 military regimes, plus several foiled coups. Economically, there was uneven progress. In the late 1990s, the bottom dropped out of 2 key exports, gold and cocoa. But in the last 5 years, Ghana's economy has started to improve.
Ghana is, by everybody's account, a relatively well-governed country in the world, yet it's impoverished and it's facing many of the aspects of poverty traps that engulfs its neighbors and most of Africa and many other parts of the world. And the drain of skilled labor, especially in the health sector, is one of those traps.
For over 40 years, there's been a trickle of Ghanaian nurses to the English-speaking developed world. One widely quoted source says almost 2,000 nurses left Ghana between 1995 and 2002. And the exodus is set to continue as nurses opt to leave a crumbling health system to earn more abroad. In the UK, some nurses can earn more in a day than they could in a month back home.
Nurses, we have of the order of about 8,000, and this includes professional and non-professional. So we're not doing well at all, and it's all because we train our human resource, train them to a very high standard, and why not? And because the systems in country are not attractive enough, the health workers leave this country for pastures new. And that is a problem, and it is a very, very big problem.
It's the major medical problem facing the world today, by a long way. Costs £220,000 in this country to produce a doctor, £12,500 to produce a nurse. But we can afford it, even though it's expensive. They can't afford it, and to expect developing countries to spend part of their tiny amount of money producing doctors and nurses to work in our health services and the American health service is quite immoral.
Which they've increased it to 15 milligrams BD.
In 2003, 43% of nurses registering to work in Britain were trained abroad, compared with just 10% a decade earlier. Lydia Kwashie left Ghana early in 2004 to work as a carer in a private NHS nursing home in Sheffield.
Back home, you could work for a whole lot of years. 20 years, 25 years, you go home with nothing. No house, no nothing, no even a bicycle.
How many have you
No, me, I'm here. I'm just 1 year, 4 months. I have my own accommodation. I mean, I'm working. I have a car. Back home, I couldn't. I even couldn't go nearer to a car tie and ask, how much is this tie?
What even actually dragged me out of the country was sometimes you see what some of our sisters, the senior sisters who are on retirement, and some of them just go and within a year or two they are dead. When you look at things, it's like you don't have a future.
We feel guilty, very, very guilty, but there is nothing we can do. Yeah. You have children, you have family. You leave them, you look back, you are crying, they are also crying, but you have to leave them. Why? Because you can't do anything, yeah.
We are concerned. We have raised the issue at the World Health Assembly recently very vehemently that the World Health Organization should do something about it to save the developing countries from losing their professionals to developed countries. We thought it was totally immoral.
Life travelled with Lydia back to Accra, Ghana's capital city, and to Korle-Bu, the premier teaching hospital where Lydia trained. The aim? To find out why nurses are leaving and meet some of the people Lydia left behind.
You miss everybody. That's my brother. It wasn't easy for me. You know, look at all these ones. I have to take care of them. If you ask them individually, they will all tell you, you know, I have to help the home. It's not been easy. My husband alone cannot take care of all of them. I have to help. And so I went to work to bring in money to help.
With Lydia and thousands like her moving abroad, Ghana will struggle to meet its commitment to the Millennium Development Goals. This is her first visit home in 16 months. She is about to be reunited with old friends and colleagues.
Look at it. This is the Department of Accident Center. Yeah. I miss you a lot. I do miss you a lot.
I'm the only one on night duty, actually. The only nurse. No assistant, nothing whatsoever. It's difficult to nurse this one alone without the mother. If the mother is not around, I'll have a really tough time at night. But her presence really makes a difference. Not yet on any medication.
Despite being one of the best hospitals in the country, Korle-Bu has a serious staff shortage. The accident department is operating on less than 50% of its recommended medical staff. The children's department has just 3 nurses caring for over 50 patients.
So if someone decides to go, you can't just hold the person, you can't blame the person. So those of us who are left behind for the time being are managing. That is to say that we are also not going to stay if things don't change anyway.
This is not just a problem for Ghana. The whole of sub-Saharan Africa is losing nurses. They are leaving at a time when, according to the British Medical Association, another 1 million healthcare workers are needed to care for the sick and dying.
Okay, so we'll put this patient here and then. Let's turn. Normally, the male patients end up there, somewhere there. But it looks like we have so many male patients that we don't have a choice but to allow them to come into the territory of the females, you know, so to speak. Sometimes the place is so congested, as you can see. You know, it's bad. The stench that comes out. So right now he's lying on the Macintosh, which is not very good for him. But there are times there are no sheets at all. We run short of sheets.
Sometimes I feel like coming back home to work in my own country to help them. But the stress that I see on their faces deters me from coming back.
You know nurses right now in this hospital that are about to leave?
Yes. I know, you know, people are planning really hard to leave, yes. Some of them ask for leave without pay, others just disappear.
Ghana is facing a health crisis as it hemorrhages doctors and nurses to the developed world. Spending on health in Ghana has gone up, but its value has decreased. In 1990, it was $4.5 per person per year. In 2004, the figure was $13.4. However, Inflation has meant Ghana is today spending less in real terms per person. Most of the money goes on wages. For almost everything else, patients have to pay. Ghana's health service operates on a user pays principle, the so-called cash and carry system. The stresses of this system is one reason health workers leave. The health minister blames rich countries for the exodus, but surely, Life asked him, this is a problem Ghana must address itself.
Well, surely that is an internal problem. But what about looking at it from the other way around? That these are the very people you call poor. And these are the very people that you yourselves are giving monies to develop. And they use the money to train doctors and nurses, other professionals, and then they come to your country and you happily, welcome them. What is the morality in this?
His opinion is that nurses should consider their job a vocation and they should show some loyalty to the country that trained them.
If you're patriotic, you will not leave, because nursing is a calling. It is not just a profession. It's a special calling to serve humanity. And if the country has spent a lot of money in training you, nurses or doctors, there's a need for you to stay there and offer your services.
That's not a view shared by the Director General of Ghana's Health Service, who takes a much more pragmatic approach.
Let me say that when you're talking to politicians, it's always easier for them to say that it is a vocation. And I think the president has even alluded to that on a few occasions, that medicine is a calling, and once you get into it, you just work. But the economies of life does not allow for that. At the end of the day, they all go to the same market. They face the same cost of living.
Professor Akosa also believes Ghana must take steps to reduce the number of nurses leaving, beginning with providing priority housing and transport.
I dare say that if we don't improve it, people will go. And improving it is providing systems where people can get mortgage and acquire a house, for people to be paid properly. People should have, facilities. If they want to own a car, by all means, let them own a car. And they should be able to look after their spouses and their children.
Okay.
But Professor Fred Sai, one of Ghana's senior health advisors, says if they invest in educating nurses and then they leave to work abroad, the system is clearly not working. He says it must be tightened to make sure Ghana reaps the reward of its investment.
Hello.
For me, the only reason why somebody can call it a scandal in terms of commerce, if you gave a person a university education, it is a value added. And a country has to pay for that education only to the extent that the education will be put to use to the country's development. So if it is not being put to use to the country's development and the individual for their own reasons wants to apply the skills elsewhere, make it more difficult for them to A, get the education, and B, to feel comfortable leaving who paid for it and go and work somewhere else.
Ultimately, though, you've got to build up salaries in Ghana's own healthcare system. They're never going to get to the levels of an NHS salary in the UK, but you can envisage a situation where a decent professional middle-class salary allows a Ghanaian nurse or doctor or teacher to live very well by local standards.
But while strategists and ministers debate, the reality of the cash and carry system means there is little funding for even basics like an ambulance service. Accident victims are bundled into the back of taxis or passing cars and driven to the accident department at Korle-Bu. 4-year-old Vincentia Mawuko is suffering from first-degree burns.
Tomorrow morning, we'll have to take her to plastic surgery. We can't just stitch it. It's first-degree burns. We'll do some plastic work on it and give her some medicine.
She had covered the hot water, which was in the bucket, with a towel. And accidentally, she was just walking and she was going back. And then she accidentally tripped over the bucket and landed with her buttocks into the hot water.
Before the barrier, okay. What I've achieved since I left is more than what I got when I was here for over 25 years. If you can bear me out, I can show you some things.
Ghanaian nurses are highly trained. So when they come to the UK, it takes just a 3-month adaptation course to completely qualify for work in the NHS.
And then I've been given my PIN number. So I'm a qualified nurse over there. I was saying that 16 months now since I went. Right. I've got my place. I've got my own place. I have my car. I have everything that somebody should have. You know, if you are given a place like a room without anything, a house without anything, you just take your card to the wherever shop. If it's the furniture shop, they will provide everything on this card. You can go to town without having money. You come home with everything, and then they will ask you, do you need money?
So at least we all want to enjoy some of these facilities, you know. We all want to be better off, you know, because like she said, some of us have also been working for years now, but, you know, with virtually nothing. You know, you collect your salary, by the end of the month, it's all gone. It's finished. My take-home salary is 1.4 something. 1.4.
It's not even £100.
Yes.
Per month?
Per month.
And you're all supporting families on that?
Yes. I have kids, you know, my mother is there, I have to support her, you know, and other needs.
Because we have the extended family.
Yes, yeah. Yes. Because I would really want to see my children, you know, grow up to a certain stage before leaving them, actually. Yes, because I'm afraid what will happen to them if I'm not around. But looking at the conditions we are in, we are forced to move out, you know. Sometimes you just have to forget about the home situation. Since you can't feed them, you can't provide for them, you know.
Vincentia's mother had to wait all day to get the money from her husband to buy the painkillers to ease her daughter's suffering. Hospitals have to charge. They can't provide even basic drugs like these.
I need to bathe him. Where are the towels? Nobody has brought a towel. Where are they?
You needed it to clean him. What he? Some of the things we experience. Now we need to clean him. They're telling us they are not living around. So it will be difficult for us to get things to clean him.
So what do we do now? We can't use that. We need towel, buckets, and disinfectant to wash him completely.
Sometimes you see, when you are knocked down, the casualties, they'll fall in gutters. There'll be a lot of blood on them, and so we clean them, make them nice and comfortable in bed. But in this situation, see, we don't know what to do. They don't buy them, they don't replace them. They think it's the government who have provided them, so we need to give them to them free. But it's not the government.
It's not only drugs patients need to provide. They must also supply buckets, disinfectant, scalpels, bandages, even blood transfusions, as well as their own food.
There are times people come to the hospital, we, the nurses, have to buy, you know, certain things for them. You buy the dressings, you buy drugs, because you realize that the person cannot do it. And you can't leave that person to die.
This morning, when we came in, they looked at the wounds. It was redressed, and I was told there was no bed, no mattress in the ward. So we were told to stay here for a while. There is a bed, but no mattress. So they asked me if I could buy a mattress, but I have no money. I told them I had no money, but if my husband comes tomorrow, I will inform him in case my husband has some money. and I will ask him to buy a mattress.
Nurses often find themselves unwittingly policing the cash and carry system, locking mothers out of the maternity ward, only allowing them back in every 3 hours to feed their babies.
Please, I'm called Abiba Imoro. I came to deliver, but after delivery I was told my baby is premature, so they brought me here. But when the baby was discharged, I couldn't pay the hospital bills. That's why we are still here. We all have the same problem. None of us has any money, that is why we are all here.
It costs parents $20 a day for their child to be treated in an incubator. For every day they don't pay their bill, it costs them another $5. There are cases of babies being held up to several months because the parents simply have no money. This exodus of nurses and doctors to rich countries is not confined to Ghana. It's a worldwide phenomenon. Some experts argue more aid is needed to pay the salaries of health workers so they won't leave.
There are many things to do to help moderate the brain drain, but we should understand that's a feature of globalization that also requires a direct response, help from the rich countries to raise the salaries of skilled workers and finance the salaries of skilled workers in the poorest countries, giving time for those economies to catch up so that they can sustain those people on their own budgets over time.
This is emergency ward. She's supposed to go to plastic, but presently they don't have bed. Treat every other day, they do dressing, depending on how soaked.
After a wait of nearly 4 days, Vincentia finally gets a bed in the plastic surgery ward, a department that is also losing nurses to the UK and the US.
The UK is poaching thousands of doctors and nurses from sub-Saharan Africa, and without any form of restitution, such as specific funding or sending our own manpower back.
Well, there's no policy to steal the doctors and nurses from developing countries. There is a code of practice we adhere to which makes sure that we don't do such a thing. But for many of these people who come to this country, if they weren't coming to this country, it wouldn't be that they would be staying in their own, I'm afraid, and that is the problem. They would simply be going elsewhere.
Well, the government is committed, as a Department of Health, will not go out to countries that don't invite it to recruit doctors and nurses. But my point is that doesn't stop private companies doing it.
If the chance comes, I will leave. If I get it, I will leave. I will leave. Oh, Europe, any place, UK or US, any place.
It's been estimated that Africa, sub-Saharan Africa, would need an extra 1 million healthcare workers. In exactly, incidentally, the same timescale that the United States are hoping to recruit another 1 million doctors and nurses from the rest of the world. It's pretty obvious which of those two opposing ideas is going to be the successful one.
So the drain of health workers from Ghana is almost certain to get worse before it gets better. Those close to the reality of the issue, like Professor Akosa, insist Ghana itself must find a solution. And when it does, many of those who left say they will return.
Without making it look outrageous.
I have always said that I don't blame Tony Blair, I don't blame the US government, I blame my government. The push factors are phenomenal. Because if my government is not prepared to put certain things in place, then I worry. We're waiting for the day when government will be bold enough to bite the cherry so that the health sector can move forward.
So if that happens, Lydia, in 5 years' time, will you be back in the country?
Yes, I'll come and serve my nation country, yeah. I'll come and serve Ghana. In 5 years' time, if it is really implemented, I'll come back. And I'm not coming alone, I'm coming with my friends. Yeah.